Has your traditional congregate meal participation declined? Do you have an increase in food insecurity, especially in certain pockets of your community? Are you trying to bring participants back with a new model or attract younger, older adult population? Whatever your motivation is, you have found your way to revamping your congregate meal site webinar chat series. And we are sure glad you're here today. The value of the congregate meal programs cannot be overstated. For over 50 years, congregate meals have been studied and evaluated, mostly in the traditional setting. Benefits of these traditional congregate meal programs have been shown to improve health and well-being by helping decrease depression, improving nutritional intake, and allowing older adults to continue to live independently in their own homes. Our network continues to meet the intents of the Older Americans Act by addressing the nutrition, social isolation, and health and well-being of older adults we serve. As the older adult population continues to change in their needs and preferences, many organizations are being creative to find multiple service delivery models. Truly, each model has its benefits. Congregate meal sites can have a wide range of variability. The Older Americans Act has always allowed for many flexibilities across the senior nutrition program. So each state, area agency on aging, and provider can create services that meet the needs of their own communities. That means tailoring the menus to local preferences, creating a welcoming environment, making referrals to local organizations to find a falls prevention workshop can benefit access, and much more. The four-part series is intended to provide area agencies on aging and meal providers with ideas to revamp and reinvigorate their congregate sites. Through this four-part series, you'll learn how to make small changes to the congregate site or large, more innovative approaches to fit your needs and expected outcomes. Before we begin, it's always important before you start anything new to reach out to your area agency on aging and your state unit on aging to make sure you meet all state and local policy requirements, including any pre-approvals that may be necessary. So, now on to our guest. The Kentucky River Area Agency on Aging has used food trucks to revamp their congregate program. This has successfully helped to increase their congregate participation and reach in new communities within their region. Stacy Noble is the Associate Director of Aging Services for the Kentucky River Area Development District, which manages the Area Agency on Aging in the Eastern District of Kentucky. She's a graduate of Berea College and has worked within the aging services for Kentucky River Area Development District for 22 years. Stacy, I am so glad that you've joined us here today to really help learn more about using food trucks in congregate settings. Can you provide a brief description of how you use food trucks in your congregate meal program?
Yes, and so thank you so much for having me today. Our agency has had two different food truck programs, and the first was a partnership with a food truck that provided congregate meals at a senior farmers market. And they provided an evening meal once a month in a congregate setting within the senior farmers market and provided information to participants. Um, for the second program, the agency recently purchased a food truck, which we are most excited about, to extend the current services to isolated areas of our region. And the food truck will travel to areas in each county that are isolated and includes populations who are not attending traditional sites. The food truck will set up in one site each day or possibly two sites in each day if they're close enough for the travel. And lunch will be served in an area where tables are available and will include packets of information. And some examples of the information and education that we will provide. Our Department for Aging in the state of Kentucky provides us with a nutrition newsletter. So we'll be giving out that nutrition education newsletter at each of our sites out of the food truck. And then also we have a lot of variety of education, such as diabetes education, healthy eating education. And, many times we are able to access these educational handouts from local partners, such as Extension Service or whoever it may be. And I do want to point out that Most recently, we did start accessing educational handouts through the ACL site, and those have been very helpful as well.
And so you're referencing the Nutrition Aging Resource Center, which I'll provide a link to that later on after our discussion. So that's great that you've been able to find some help with some of those resources. And I guess you can call what you're doing with the food truck sort of pop-up sites, since the meal is served in a variety of locations. Can you tell us why you wanted to start the Congregate Food Program?
Yes. So during COVID, our region brainstormed different ways older adults could access meals. And this opened up the idea of providing meals at the senior farmers markets. And our agency contracted with a local food truck to provide meals at the farmers market as a congregate site. And the goal was to bring awareness of the program to older adults that, we've not served before.
It's wonderful to see how that brainstorming and collaboration led to this addition to your Congregate program. What benefits have you seen from using the food truck service?
We have saw a lot of benefits, and we had been worried about not reaching enough of our older population. So because of that, and because since the pandemic, and over the last couple of years, we had not had quite as many seniors who were coming in,
Mhm.
and the ones that consistently had been coming in, some of them had passed away. And so it was a worry of ours to find new people out in the communities. Are we serving everybody in every area? And so we really came back to looking at all the communities that we're serving, and we began looking at pockets in the community where we were not serving any elderly adults at all. So adding something different with the food truck was a way to work with a new group of people to serve the elderly, and to also find that new group of people that we had not been serving. And so in our area, it is seen that like the elderly do not want to come into the center because of the perception that they're not old, that they something they really just don't want to do. So we got to thinking about ways to pull them in, and the food truck was that way to maybe take that perception away, because a food truck is young. It's perceived as young and something hip and of the time, because everybody loves food trucks. And so we do have one community where a husband and wife, they were in their early 60s. They started coming to get meals through the food truck, but then it led into them coming to the center to get meals after that. And then they live in a community where they have a lot of family members and friends in their little small community, so they talked them in to start coming as well. We've never served these people before, but now we have those people with food truck and with coming into the center. So it was a good way to find a new group of people. So we feel like the food truck has been a successful outreach for us. And since we started the programs, we began to see that serving older adults who were not previously attending congregate sites, we're reaching a new demographic of older adults, especially those who work or unable to attend a congregate meal site. And food trucks can set up where you need them most. We've had an increase in participation in the counties where we have provided this service, and the awareness and the participation in all the services available in these counties has improved. It has also been helpful with increasing collaboration with local businesses and locations where the food truck visits.
Stacey, I know that you use food trucks in a couple of different ways. So let's start with your food truck partnerships. What action steps do you recommend when starting partnerships with a local food truck vendor to provide meals for your congregate site?
So, a great thing about using partnership options is that it may not cost any more than you're already spending per meal. Using a food truck is similar to a restaurant partnership. And you can start by visiting a local food truck to discuss partnering with your agency. Educate them about your program, invite them to visit, review the menu together, and provide suggestions on what can meet the requirements. And I will say, work with your local state unit on aging on what that menu option can be to get that approval, because that's what we did. And work with your vendor or your food truck on an appropriate price per meal. Review the contract that you set up with them in person, and allow suggestions, allow time for review. Set up a schedule for the food truck sites and times, set up a process to collect participant information of those participants who are going to be accessing the food truck. Set up your rosters, your data collection system, and your invoicing. And consider an electronic option if that's something that you want, with key cards or key tags, because it's really cool. And schedule a practice day and have seniors sign up to participate and take pictures and continue to advertise with your community. Really post it on Facebook, on social media to get the word out there.
So those action steps really help providers start on the right track. And I would love to add that the Nutrition Aging Resource Center, as you mentioned before, has several resources that viewers can find helpful. So they do have a Food Truck 101 for senior nutrition programs and a resource that's called Meals in Motion. And both of those will provide guidance to the network on how they can utilize food trucks to innovate nutrition services. Stacey, you mentioned in addition, your agency has purchased a food truck and it will be used to travel to isolated areas to provide congregate options to older adults in your region. I know this service has not officially begun, but can you provide us some action steps that could help others who are interested in the same service?
Yes, and this option does take a bit more planning compared to partnering with a food truck. However, it can be very much effective for reaching new participants, as well as it provides a resource to use in the event a kitchen is shut down during emergencies. And those emergencies can happen at any point, anytime. And as far as action steps, I would start by fundraising or applying for a grant to purchase a food truck. Use your business and local government partnerships to generate funds or other support, and follow the procurement process to purchase and retrofit the truck to meet the needs of the agency. And I've provided a sample floor plan that we're using for our food truck, and it will be available in the list of resources for this series and on the Nutrition and Aging Resource Center. So you can also find several other resources to help guide you, as mentioned before. And also plan staff to manage the food truck operations. Our food truck manager will work 5 days per week. This staff person will drive the truck to the sites. They will cook. They will keep the truck stocked with food items needed to follow the approved menu. They will do the food ordering each month, and they will give out the education and the information to the elderly at each of the sites. And also, I would suggest meet with nutrition site directors to identify your regions currently not participating at traditional sites. Identify food truck sites to set up. Look at an area with available tables and space for activities, which is what we've had to do and set up on our calendar. Identify approved menus that meet nutritional requirements for the program and can easily be served using the food truck. We've looked at some different options for our food truck menu that are a little bit simpler, but nutritional. And develop a schedule of locations and times that the food truck will visit, and develop activities and packets of information to provide to participants. And some of the education and information to be given out to participants, in the packets that we'll be giving out. We've tried to include, of course, diabetes education, healthy eating, but also things such as fall prevention, and timely things such as winter safety tips, summer safety tips, vaccine education, a variety of the things that they need to know, as an elderly individual. And advertise sites and times to each county through your Facebook sites, your websites, and local newspapers, radio, all those sorts of entities.
And it's great to see even providing a pop-up site can increase your awareness for your programs and generate new, participants and partnerships. Sometimes just being in the area really will advertise, what you have available. What advice would you give someone interested in using a food truck in their congregate setting?
I would say be patient and give yourself and your vendor time to understand the process. Maintain good communication with your vendor and be transparent with requirements. Use the current menu to simplify the process. Choose easy adjustments. Don't be afraid to serve at different times during the day. Identify the best location to serve older adults who are currently not being served.
Stacy, I want to thank you for sharing your congregate food truck options. You've shared two congregate revamp ideas that are very exciting, and we wish you the best as you launch into your own food truck venture. I know that's exciting and scary all at the same time. I hope that those watching will find this information helpful and encouraging. Being able to identify a need in your region and filling that need in a new way is the definition of being an innovative. The senior nutrition program has proven to be beneficial to older adults. However, if older adults are not participating, they're not able to benefit from the services. By revamping your congregate meal sites, you can potentially increase awareness and participation within your services. Therefore, you can make lasting changes in the lives of older adults you serve. I want to thank you for watching today. I've posted, as you can see, Stacy's contact information and the link for the Nutrition Aging Resource Center where the webinar and the other resources can be found. You can find the takeaway sheet from this webinar and much more at acl.gov/senior nutrition. From there, you'll click on Browse Resources, you'll click on Congregate, and then you can go to Creativity and Innovation. And there's an entire page of resources that you can choose from that has different delivery service models, it has food trucks, it has restaurants, it has everything you can think of on how to be creative and innovative. Stacy, I want to thank you for chatting with me today. I really appreciate you joining in.
Thank you, Catherine. It's been great to chat with you too.
So everyone be on the lookout for more webinar chats coming your way to help you explore ways to revamp your congregate program by using ideas like restaurant partnerships or even incorporating small changes to your traditional meal site that can make a big impact. Thank you for watching and I'll see you at the next chat.